benign laryngeal cancers, or should I say benign laryngeal tumors, to make it more accurate. And yes, we're going to be doing the whole thing in 3 minutes, as you heard, right? So let's get right into it. So papilloma, what is a papilloma? So basically papilloma is either it's sessile, or it's solitary, or it's multiple. And basically what this does is it causes a lot of hoarseness of the voice. It causes our voice to be quite rough. And not only that, but it causes respiratory obstruction. So how would we identify this? Well, we would identify this with a laryngoscope. I kind of made some notes over here. I'd like to share them real quick about the different type of examinations in different parts of the body. So anyways, in this papilloma we will be doing a laryngoscope. So we will be doing a laryngoscope, and if we have to do with nasopharynx, we do a posterior rhinoscopy. If we're doing the oropharynx, then we would do a pharyngoscopy. And if we're doing the laryngopharynx, then we do a laryngoscopy. In the esophagus, we could do esophagoscopy, and that can be rigid or flexible. Anyways, papillomas, they lie in the oropharynx. They also lie in the subglottic space. The treatment is going to be tracheostomy, because a tracheostomy it would allow it to have direct it would allow us to kind of breathe properly, and we can also these can go into malignant transformation. Laryngeal papillomas are usually due to HPV and in adults, and they are usually single in adults and multiple in children. We also have polyps over here. Polyps, these polyps are going to be otherwise known as they cause hoarseness, they cause aphonia, they cough, and dyspnea. So you can kind of remember 2 respiratory symptoms such as dyspnea and cough, and 2 vocal symptoms such as hypophonia and hoarseness of the voice. And this polyp is like a pedicle. Pedicle means that there's a kind of like a stalk and then the main thing, and it occurs in 30 to 50 years old, and hyperkinetic and vocal abuse. Again, like I said previously, we're gonna have to use laryngoscopy because we're in the larynx, and obviously nasopharynx with posterior rhinoscopy, and the oropharynx would be obviously pharyngoscopy. And treatment will be microsurgery. We can do endolaryngeal microscopy. We can make sure that we can preserve the vocal ligaments, vocals, and and then the next one is called Rectum Edema. Rectum Edema is basically a potential space. It's kind of a potential space between the vocal ligaments and the overlying mucosa, and it is not an empty space, but it contains cells and fibers. And basically, if we get edema here, it's going to be hoarseness, the diplophonia, deepening of voice, which diplophonia kind of means like your voice becomes kind of more thick in that sense, and this is due to smoking. So you kind of have 2 tones at one time, and it occurs in the rectum space, and the treatment is going to be by stripping the mucosa and doing microsurgery. So and you can diagnose again by laryngoscope, which is the main thing for larynx. So guys, I hope you guys found this useful, and just remember that papilloma is solitary multiple. In adults, just remember it's always solitary, and children it's always multiple. And make sure you know the diagnosis, which is laryngoscopy, which is very classical for the larynx, and pharyngoscopy for the mouth, and then posterior rhinoscopy for the nose. We can do papillomas. We can see papillomas in the oropharynx. We can maybe see in the subglottic area as well, and they do go under malignant transformation. Focal point nodules are going to be there. They cause 2 main symptoms, which is going to be dysphonia, and dyspnea, and they can also cause aphonia and hoarseness, and they can cause, and this is going to be in men and who do a lot of vocal abuse, quite similar to Singer's nodules or the vocal cord nodules, which are going to be they're going to be degenerative myxoid connective tissue, and again do surgery to remove them. And so hope you guys found this useful, and I hope to see you guys. Please do like, subscribe, and thank you for watching this video. I hope to see you guys next.